Okay, we'll go ahead and get going. If somebody joins us, hopefully they won't be too late and miss very much. But we're going to go ahead and start on the topic of Medicare. I'm Maria Pearson with Henriot Group. I head up the Henriot Health 65 division. Been doing this for about 8 years now, and hopefully you will find the discussion and the presentation here very helpful as you start to transition that direction. Okay. With that said, I'm just going to go ahead and explain to you what Medicare is. Medicare is an insurance program offered through the federal government. Anyone turning 65 is eligible, so it doesn't matter what your full retirement age is for Social Security. You are still currently eligible to start your Medicare at age 65. Now, some people with certain disabilities may also qualify for Medicare prior to 65. Things like end-stage renal disease, or if you receive a Social Security disability check for more than 2 years or going on 2 years, you will automatically become eligible at 24 months of disability. Okay, so just keep in mind it will start the first of the month that you turn 65. Medicare versus Medicaid. I like to make sure I explain this because it is a very confusing item for people. Think of it this way: Medicaid is aid for those who lack resources or income in order to provide themselves the health insurance they may need. Okay, someone may qualify for Medicaid and Medicare at the same time. They could qualify for Medicare due to disability and lack income and resource levels. They may qualify just for Medicaid if they are under 65. So just keep in mind, you could have both. You could have one or the other as well. So the parts of Medicare. Now, this is the first part of our alphabet soup. So we have Part A, which covers your hospitalization. And then we have your Part B, which is your medical insurance. Most people like to be reminded that that medical insurance covers your doctors and your outpatient services. Now, under Part B, that is where you would find things like chemotherapy, durable medical equipment, those items as well would be covered under Part B. And then we have Parts C and D that were introduced in 2006. Part C is Medicare Advantage plans. We'll get into more detail later on those. And Part D is your prescription drug coverage. And there are a couple of ways to obtain your prescription drug coverage. So, you know, you're turning 65. The biggest question that I get from people outside of, you know, well, what do I do? What do I have to do? What are the penalties? Would be, what is it going to cost me? How much will it cost me when I move to Medicare? So we're going to cover a lot of information here. There are some things that will be the same for everyone. There are some things that will vary a little bit. So as of 2020, okay, your Part A, we have a deductible, which is $1,408 if you go to the hospital, okay? So you would still have that out of pocket that would cover you for up to 60 days. Day 61, you begin paying a copay per day of $352 a day. And day 91, you start paying $704 a day. Day 91 through 150, those are lifetime reserve days. So you only get those one time in your life. Now, what I mean by that is if you were in the hospital for 100 days, you may use 10 of them and then still have 50 to use later on. Now, you do still have all of that out of pocket, but the nice thing to know is the premium under Part A is $0. So you would not be paying any premium. It is important to know that you won't pay premium as long as you paid Medicare taxes for at least 10 years, or if you were married to someone for that long who was paying those taxes. Okay, so for most people, Part A is free. Part A does also cover some hospice care, your blood, and potentially up to 100 days in a skilled nursing care facility. Just keep in mind, long-term chronic care in a skilled nursing facility would not be covered under any part of Medicaid, or I'm sorry, Medicare, and it's not covered by any of the other plans. You would have to buy a separate long-term care policy to have that covered. If you would happen to go on Medicaid, it will help take care of the long-term care. Now, we also have Part B, and again, that's where your doctors and outpatient procedures are covered. You do have an annual deductible of $198, which is the first amount you pay towards any doctors or outpatient services. Once you pay that, Medicare begins to pay 80% of your bills, and you would pay 20%. They're always working on the Medicare negotiated rates when they calculate the 80 and the 20. Now the premium for Part B is currently at $144.60 a month. That is the base premium. If you are taking Social Security, that will come out of your Social Security check. If you are not, they will bill you quarterly for that. You will notice I have note IRMAA there. So IRMAA, I-R-M-A-A, stands for Income Related Monthly Adjustment Amount. So what you need to know is that if you're a joint tax filing family, if you make more than $174,000 in a year, 2 years ago, they always do a 2-year look back, then you'll pay more than that $144.60. There's a graduated chart there. If you are an individual tax filer, it's going to be $84,000. So keep in mind, if your income 2 years prior was higher than those amounts, you'll want to request an IRMAA sheet from me, because I can give you a perspective on what you would pay for your Part B premium. Okay, so just keep those numbers in mind. $84,000 if you're an individual tax filer, and $174,000 if you are a joint tax filer. Okay. You do not have an out-of-pocket maximum under Medicare, so you could potentially continue to pay costs. So there's no insurance maximum like you might see on your group plan. Do note that this is one area where you could be penalized, is under Part B. So if you don't pick up Part B when you're first eligible and you don't have other qualifying coverage, you will be penalized once you do go to pick it up. And there's a set period of time that I could get you there. Now, do know if you are on employer coverage, you will avoid the Part B penalty, and you will be granted a special election period to pick up Part B when you retire. Okay, just that 10% penalty would only occur if you do not have employer coverage or other qualifying coverage. COBRA would not be qualifying. Having VA benefits is not qualifying. So just keep that piece in mind when you're turning 65 or becoming eligible. Make sure you're doing your homework so you can be avoiding those penalties. Part C, I promised a little more information on Part C with Advantage plans. So these plans are operated by private insurance companies. They basically replace the original Medicare benefits, so you would no longer work on those deductibles or coinsurance under A and B. Your claim goes through the private insurance company, and then they pay instead. They will set their own copayments, their own coinsurance amounts. They're required to have a maximum out of pocket on those plans, and many will incorporate your Part D coverage. The plans that don't incorporate Part D for your drugs would really only be applicable in most cases for people who have veterans benefits. So keep in mind, if you don't have veterans benefits, you still want to pick up a plan that would have Part D attached to it so that you avoid the next penalty that we'll talk about here coming up. So Advantage plans, claim would not go through Medicare, it goes through the private insurance company. They also are allowed to set a network of providers that you are able to see at a better price. Some of the plans will operate on what is known as a PPO model, Preferred Provider Organization. With that plan, you can go to any doctor, you just might pay a higher copay if you go out of network. If you stay in network, you're definitely saving yourself the most money. Now, also some plans will be operated on an HMO model where you will have in-network benefits only. So it's important to understand if you have an HMO, who's in your network, who are you wanting to see, and definitely I would advise with the Advantage plan that you make sure all of your doctors are covered that you really want to have access to before you choose the plan. These plans you can change very easily each year during the annual enrollment period, okay? They refer to that as AEP. You'll see 1,000,001 commercials that time of year, but October 15th through December 7th, that's when you would want to make that change. The new plan would begin January 1, okay? So lots to think about when it comes to Advantage plans. They're just a different way of being covered, but they technically do replace original Medicare. Prescription drug coverage. This also adheres to that annual enrollment period. So if you want to change your drug plan, this is the time of year that you could do that. The October 15th through December 7th deadline. They do change every year. Okay, so it's important. You may want to stay on your same plan and you would need to do nothing to do that in the next year. But if you've had a lot of medication changes or you've changed pharmacies, you will definitely want to review it. You can incur a penalty under Part D. So this is the other penalty that can occur. That penalty is 1% of the average cost of a drug plan, okay? And they take that times the number of months that you did not have qualifying drug coverage and should have. So if you go for 2 years without a drug plan, that would be for 24 months. And then currently 1% of the national average cost is 0.3274. So 3274 is the average cost. So they take that 0.3274 times 24 months. That would be your penalty for the remainder of your life. You pay it every month. Okay, so very important, even if you're not taking medications, to really consider a drug plan. Also, because if you don't choose it when you are having either your initial eligibility or special election period, then you could only choose it during that AEP timeframe, and you could go without drug coverage for longer than you need to. Okay. That penalty does get charged once you do sign up for the drug coverage, whether it be a standalone or through an Advantage. All right, any questions right now? I know we just covered a lot on the basics, but if you do have any questions, feel free to type those in the chat bar. I'll give you just a minute. It doesn't look like anyone has questions, so we'll move forward. I'll give you some time again later on, but don't hesitate to jot those down if you do have questions. All right, so when can I sign up for Medicare? You can sign up for Medicare when you first turn 65. You have a window of time that they refer to as your IEP, initial election period. That window opens 3 months before the month that you turn 65. It also closes after 3 months following the month you turn 65. So right here we have what we call an initial enrollment period chart. The reason it's important to be aware of this is if you were to be retiring in the few months following your Medicare eligibility age, you could really run into a pickle, okay? So let's use an example of someone who turned 65 July 15th. This column here with the EC and X would be July. So they're eligible to start their coverage July 1st. They could do that enrollment anytime starting in April. If they fill it out April, May, or June, their coverage will start July 1. If they were to fill the application out in July, it becomes eligible August 1. If they fill it out in August, you will see you cannot get your coverage until October. So it's important if you're thinking about retiring here in this middle zone, you may, if you wanted to retire in September in this scenario and start your Medicare in September, you may actually have to pick up your A and B to begin in August, and then you can always enroll in your other coverage to start in September. but you'll have to pay that extra month for A and B, and that's okay. You could still be on your employer coverage with A and B, okay? I wouldn't necessarily, it's going to depend. We're going to talk later about whether or not you need to pick up A and B if you're still working. We're going to go over some of those details, but just keep this chart in mind. Always know if you want to start the month that you turn 65, do something in those 3 months prior, okay? You do also need to know if you're lucky enough to have your birthday on the first of the month that you're actually eligible for Medicare 1 month prior. So if that person had a July 1st birthday, they would be eligible June 1st instead, and that would be the ECX column, okay? Now, when you retire, you are also given an option to pick up your Medicare, okay? So if you're over 65, don't stress about it. You will still be able to get there. As long as you have had qualifying coverage, it makes it very easy. Now, don't retire and be over 65 and not pick up your Medicare. You'll run into pickles and you'll end up with penalties. So over 65, you can start that enrollment process 3 months prior to the month that you need to start having your Medicare. Now, here's where I want you to make a note. If you are over 65 and looking at retirement, I would highly suggest that you ask your human resources director when you will lose coverage upon your last day of work, or is it the last day of the month that you work? So you need to plan that because Medicare can only begin on the first of a month. So if you're leaving your workplace on April 15th, do you lose your coverage April 15th or do you lose it April 30th? Do we need to go ahead and start your A and B on April 1st so you at least have some coverage? Or can you just go ahead and start it all on May 1st in that scenario? Okay, so that's where another point where it's good to be specific and strategic with your planning. You do also have 2 months then after your last day of employer coverage to get enrolled in Medicare, okay? And then certain plans, they'll give you another 6 months on top of that, but it's not all coverage. I tell people to be safe, try to stick within a 5-month window so that you don't lose the ability to pick up something and end up with penalties or lack the ability to pick up coverage that you really need. So I want to give you an example here. In this scenario, this individual was going to lose coverage on May 31st through their employer, okay? They lose coverage May 31st. We're going to start Medicare June 1st. They have forms. There are extra forms that have to be filled out if you are over 65 and retiring. Okay, those forms are Social Security forms. You can get them from the Social Security office, online at ssa.gov, or you can even email me and I will send you these forms. Okay, one form your employer has to fill out, the other form you would be completing yourself, and you note under remarks what day you want your Part B to start. Those forms get handed in within the last 90 days before you need to have your Medicare. Okay, the earlier in that 90-day time frame that you hand them in, the better, because it will give you more time to get your other coverage in place. Because we've been talking about workplace coverage, I want to bring up health savings account plans. So once you would have Part A Medicare, you do have to stop all contributions into an HSA plan. You cannot continue to be contributing to the HSA account if you have Part A Medicare. Now, the good news is that unless you're taking Social Security, you don't have to pick up Part A. So if you're continuing to work over age 65, you're contributing to a health savings account, you're wanting to take advantage of those dollars that are being put in there pre-tax, you can continue to do that, okay? But as soon as you pick up your Social Security, they will mandate that you pick up your Part A Medicare. So if you do have Social Security, you're going to have your Part A. Now, If you're someone who you're not taking Social Security, you accidentally enrolled in Part A, there is a way to disenroll. Okay, you would want to contact us. I can help walk you through that. But just be aware that HSA and Part A, they don't work well together. It is also important to know that when you go to retire, that you do need to stop those HSA contributions in advance because they will backdate your Part A up to 6 months, or they will backdate it 6 months, but not before the month that you turn 65. Okay, so that's where being strategic, planning out your timeline. Most people do contact us anywhere in the 4 to 6 months prior to being eligible for Medicare or prior to retirement. And that really helps people to set their timeline. All right, any questions at this point on when can you enroll? I think we have a pretty quiet group out there. Hopefully that means I'm doing my job explaining everything here. Okay, well, again, if you do have one as we're going through, you can always type it in the chat window at that time. All right, what are my options once I decide, hey, I'm retiring or I'm turning 65, I'm moving to Medicare? So people look for additional coverage to pick up what Medicare doesn't so that they're protected somewhat from those other costs. Your first option is to choose a Medicare Supplement. And when you would do that, you would also pick up a Part D drug plan, a standalone plan, because the supplements no longer will cover your drugs. Medicare Supplement and Medigap mean the same thing. They're the same plan, okay? They're just two different words that they're using for it. Your second option is that Medicare Advantage plan, that Part C that we talked about earlier, okay? So Part 1 of option 1 is this Medicare Supplement, also known as Medigap. You will see here, we get into some major alphabet soup. You have lots of different lettered plans. These are plans and not parts. The easiest way for me to explain this is if you were born in 1954 or before, and you had wanted 100% of what Medicare doesn't cover taken care of, you would elect a Plan F, okay? Plan F would cover you 100%. Now, it has gone away for anyone born in 1955 or later. In fact, C and F both went away. With that, we've really seen more people, at least in our area, join Plan G, because G is very similar to F with the exception of the Part B deductible. So under a G plan, you would have to pay that Part B deductible. That a deductible is $198. It's the first amount you pay towards doctors and outpatient services. But the G would cover 100% of any other hospital care that you would have, okay? So a lot of people like that it's a pretty predictable plan. Of course, you'll pay a little more premium for it to get that predictability. From there in our area, really the next most valuable plan people will see will be N. Pretty similar to G, but you do have copays on the plan. Currently, it is a $20 copay if you go see your primary doctor, a $50 copay if you go to the emergency room, but you're not admitted to the hospital. So those are the two copays that could occur. Down here, again, you can see you would have that Part B deductible of $198. And then the Medicare Part B excess charges there would be if you were to go see a doctor that doesn't take Medicare, you could be charged an extra fee on top of what Medicare's negotiated rate is. Now, they do have a cap on that. Currently, on the national level, it's 15%. Okay, so G and N are really going to be your most comprehensive coverage. We also have the G1 here, which is a high deductible G. You would pay the first $2,340 towards your medical expenses. You follow the schedule under original Medicare, but once you meet that $2,340, everything is covered 100% under a G high deductible. Now the second part of option 1 is your drug coverage. That drug coverage I mentioned before, the average cost is $32.74 a month. I will tell you, I'm in Tippecanoe County in Indiana. In really all the surrounding counties and the areas that we work primarily with at this point, and most of Indiana even, most people really are on a plan that is $21 and less, okay? We don't see too many people needing to go with a higher premium unless they're taking several brand name or specialty medications, and then they might need to go with a little higher cost, okay? But for the most part, if you're in Indiana, you're going to be looking at definitely less than that average. There is a tool that we use on Medicare.gov. This tool says, hey, these are the list of medications that you're taking, which plans cover your medications the best and have them in the best tier, because they will all have a formulary, which is a list of medications covered by the plan. They'll put them into tiers for pricing, and that tool will determine which plan would be best for you. It also requires your pharmacy, because it is going to say which pharmacies are preferred network pharmacies for that plan. So it pieces that information together. Of course, you have to use your zip code as well, because these plans are all very zip code county specific, and it will tell us how can we save you the most money when you're on Medicare. We want to make sure that you're not paying more than you need to be. Now, you can, again, change the drug plan very easily during the AEP, October 15th through December 7th. The new plan would go into force January 1. Now, if you're on a drug plan and you don't feel like, anything has changed, you're still at the pharmacy, premium is good when they send you your annual notice of change, you don't have to do anything during open enrollment. It's just important to know that if you've had a lot of changes, you get your annual notice of change and it shows your premium increasing a lot, we can do something for you and review that. These are some examples of what you could potentially expect in cost under option 1. So you'll see here, it does say specifically male, age 65, non-smoker. That is because on the supplemental side, premiums are dependent of how old you are, and whether you are a male or female, the zip code that you're living in, and whether you use tobacco or not. So those components can all play a role in your premium. It is also important to know that Medicare Supplement premiums do increase over time. So each year they will have an increase in premium. Okay, it's pretty rare. I've seen a couple go down a little bit here and there over time, but most of the time they're increasing a little bit. Their costs of care gets a little higher, and the government resets those deductibles and what the plan would have to cover. Okay, from there, again, option 2. Option 2 is simply that Medicare Advantage plan. It replaces the benefits under Medicare. They're going to set their own schedule for copays, coinsurance. They'll have an out-of-pocket maximum. The claim goes through the private insurance company. Okay, so they're required to pay claims that original Medicare would cover. Okay, and if you're in network, you're not going to pay more than that 20% on a Part B type service, okay? They're just not required to cover all of your portion like a supplement. They're going to set their own copays or coinsurance or set dollar amount or range depending on the procedure. Again, it's important to choose one that has your doctor in network. So that's a very important component. Want to make sure, are you comfortable with an HMO? You might pay a lower premium, but do you like the fact that you have to stay within the network only and you can't go outside of the network? Again, if I didn't mention it before, if you do have an emergency somewhere, it would always be considered an in-network option. Okay, these change yearly. You can change them during your annual enrollment period. In fact, if you're on a supplement, you can move to an Advantage plan during open enrollment, but you cannot move back to a supplement on a guaranteed basis during open enrollment. You may have to answer medical questions if you want to get back to a supplement unless you're within the first year of having the Advantage plan. Now, most of these do have perks on them. That's one thing that people really like about Advantage plans. Many of them will have some dental or vision. They'll have gym memberships, those types of things. You might find some perks on supplements, but not like you will on an Advantage plan. So typically, those are some of the extras that people just really enjoy having. Now, this will give you kind of an idea of what to expect. On the left-hand side, we'd be looking at more of like a PPO style option. They tend to run a little higher premium. You would have deductibles, copays, co-insurance. You have a max out of pocket. It could be lower in network and higher out of network. Then you would have a medication copay depending on what tier your medication is in. On the right-hand side, you can see there's only one max out of pocket. That would be more in line with something that could be on an HMO model. So you have to stay in network, but you'll see you're paying very little premium for that. Okay. So hopefully this gives you an idea of what to anticipate financially under the two different options. That's where people need to break down what's important to them. Believe it or not, you probably have a philosophy about your health insurance. Do you pay less premium but pay for services as you go along, or do you pay more premium and you don't pay much as you need services? So different things to consider. Okay, I want to talk now about what would happen if you pick up Medicare and you have your group health plan, okay? Now, first off, the top one, if you're 65 or older and you have more than 20 employees, your group health plan is always going to pay first. In this scenario, I wouldn't advise anyone to keep Part B. There's no reason for you to pay that Part B premium if you're continuing to work, okay? You really don't need to pick up A if you're on a plan that offers an HSA and you're contributing to it. If you're on a copay style plan, you may as well pick up A. It's $0. But just know your group health plan would always pay first. It's actually probably most important, not to pick up that B, because when you do pick up the B later in your special enrollment period, it gives you the opportunity to have a little more flexibility about where you would go for coverage. What do you want, an Advantage? Do you want a supplement? Which plans do you want to pick up? Now on the bottom it says if you're 65 or older and you have group health coverage, but you have fewer than 20 employees, Medicare would pay first. This has been a very important component to be aware of in the last 5 years or so, because most of these health certificates will state that you have to pick up your A and B if you're on that employer plan. And you need to do so to make sure that you have coverage, that initial coverage under A and B, because most will only pay as if you do have it. Okay, so like that 80% under Part B, if you don't pick up your Part B, you have fewer than 20 employees, you could end up being responsible for 20% of the cost of your service. Okay, so just be aware if you have less than 20 employees if you need to pick up A and B both. Sometimes it makes sense to do that and not move to Medicare, especially if you're covering a spouse who's under 65, because it might be less to pay to have them on the group plan than to go to an individual plan. Now, the same thing applies for people who are Medicare eligible but under 65. The biggest difference is that they use 100 employees instead of 20. So if someone is eligible for Medicare and they are not 65 yet, if there are more than 100 employees, the group plan would pay first. They don't necessarily need to keep B. But if they are eligible for Medicare and they're under 65 and they have fewer than 100 employees, they should probably pick up both A and B. So again, a time where you might need to really consult and figure out based on your health plan. All right, so prescription drug payment stages. I'm not going to go over this in fine detail. I only want to mention it because the coverage gap here, that is the typical term for donut hole, which is the nickname. And a lot of clients will come to me and say, my friend says they hit the donut hole. I got to be aware of this donut hole thing. What is the donut hole? So the donut hole, it has improved over the last few years. The cost now during the donut hole is only 25% of the retail cost of a medication. Now, where that can be scary is, let's say you're taking an insulin that has a full retail cost of $1,000. So when you start here at the beginning of your plan year in January, or if you start Medicare in the middle of the year, when you start, they're going to count all of your deductible if you have a deductible. Okay, they're going to count anything that you're paying for the medication and anything the insurance company is paying. Okay, so really that $1,000 price of that insulin would be counted there. So you can see when you would get into your 5th month, that full price, you've reached over $4,020 in cost. So during this initial phase, even though the medication is $1,000, you may only be paying, say, $85 for it. But when you hit this coverage gap or donut hole, you will be charged 25% of that medication cost. So now instead of paying $85, you're paying $250. And between the $4,020 and the $6,350, they only count what you pay. So it takes a little longer sometimes to get here from the $4,020 to the $6,350 than it did to get into it initially. Okay, so just keep this in mind. If you were to be expected to hit the donut hole, it would show up when we would run your medications on Medicare.gov. Okay, so just know really, it's really a small percentage of our clients anymore do hit that donut hole. This helps people with their planning, and we'll use the Medicare.gov tool to help you know whether or not it would affect you. All right, any questions at this point? Okay, well, we're almost done, but I did want to make sure that I point out to the Medicare.gov site. When you get on there, there are lots of tabs across the top. You can see supplements and other insurance. They'll go over some basics on this tab. If you go under sign up or change plans, that's where you'll really get into the nitty gritty to find the Medicare.gov plan finder, be able to price out Part D and Part C plans. If you're looking for premiums for supplements, generally you have to go to the supplement tab, and then they'll have you enter information, and they'll have an insurance agent contact you or put you in touch with the multitude of companies that offer supplements. You're not going to be able to get premiums for those plans right here on the site. The premiums that you can find on here have to do with Part C and Part D. Okay, lots of great resources though. If you take a lot of meds and you need help paying for cost, there are programs available. The Medicare Savings Program, if your income might be at a certain level where you could qualify to have help paying for, say, supplements, those types of things as well. So lots of good resources here. And of course, we're here at Henriot to help you. Both Dakota McKinley and myself, we are fully certified Medicare agents. We are what you would consider a broker. We work with a lot of different insurance companies. So we're not going to have you come in and just present to you one company. We're going to talk about how Medicare works, help you figure out which philosophy works best for you. Is that option 1 or option 2? And we're going to talk about the carriers and what would fit you the best. So we encourage you to give us a call or send us an email. If you do need any of those documents I mentioned through the presentation, don't hesitate to ask. And otherwise, I'll give you another minute if you do have a few questions, but happy that you joined us today. Okay. Thanks again for participating.